Living on Haida Gwaii comes with its challenges. It's remote, there's not many services, and housing is in short supply. But the recent suspension of intravenous chemotherapy services in the region is especially raising concerns. Northern Health was unable to provide further comment as to why chemo services were suspended, but Queen Charlotte City Mayor Chris Olson and Masset Mayor Barry Pages said they were both told that Haida Gwaii currently does not have a pharmacy technician who can mix chemo drugs for patients. As a result, patients will have to travel off-island for care.
But we have a number of patients that need this therapy, so they're going to have to travel to either Prince Rupert, Terrace, or Kitimat to receive their chemotherapy. And so that's, the financial cost, time cost, the emotional cost. They just keep adding up, and then time away from family. I mean, we all heal better at home.
This isn't the first time this has happened. In May 2019, chemo treatment was also suspended after Northern Health couldn't find a new pharmacy tech. And Olson says that many had to regularly travel long distances for care.
They had to totally suspend what they were doing and uproot themselves and, basically move to, where they could receive the treatment. So it's, this is just really, it's really sad.
The ferry from Haida Gwaii to Prince Rupert can take up to 8 hours. And that's if your sailing doesn't get cancelled. Pages says that travel will especially be difficult for patients.
It's not as easy for Haida Gwaii just to people to jump in their vehicle and drive to a neighboring hospital. It's very problematic with limited ferry service that we've got, and particularly in the wintertime when we can go a week without a ferry. So my concern is people just won't be able to get there to get the treatment when they're scheduled.
Haida Gwaii is no stranger to healthcare challenges, and Pages says he wants to see the province come up with creative solutions for the future.
They're not really looking at some outside-the-box thinking for these rural and remote areas, that it is difficult to recruit and retain professionals, and I think that they need to look at different approaches for these rural areas.
For CFTK-TV News, I'm Joshua Azizi.